The project that we were working on this year was trying to innovate a new penile implant design that would hopefully have some advantages for patients moving forward. So this project was really about trying to incorporate some novel approaches and technologies and apply them to these penile implants to see if we can make a slightly better device or a better patient experience. So what we chose to do is incorporate the concept of, or the field of, soft robotics. So we've been busy and working hard since the Innovators Challenge, and really we've been working on creating initial prototypes for the different types of soft robotics for proof of concept. And now we're working on fine-tuning the designs and the geometric shapes, fine-tuning the materials to arrive at the end product that we're interested in.
In this project, or in this collaboration, we propose to create a novel paradigm-shifting penile implant, leveraging nanocomposite biomaterials and soft robotics technology that are capable of changing physical characteristics based on a unique stimulus. I believe that we are on the right track.
Now that we've created initial prototypes for proof of concept, we're going to be working on fine-tuning this design for the soft robotics portion, as well as fine-tuning the nanotech material to the physical properties that we need. We'll also be working on a microfluidic pump to support this system. So hopefully over the next 1 to 2 years, we'll be looking at hiring additional graduate students and arriving at a more finalized prototype that we can look at implementing more towards the clinical application.
My project focuses on obstructive sleep apnea, which is a disease that affects over 1 billion people worldwide. So obstructive sleep apnea is a very common respiratory disease that affects approximately 1 billion people globally. In fact, individuals with sleep apnea have a 3 times increased risk of cardiovascular disease. They're also at increased risk of other diseases such as cancer and dementia and chronic kidney disease. We have made substantial progress on our project over the last year, specifically in terms of increasing our access to data, hiring personnel, as well as identifying some very preliminary features that we think will be of relevance. So over the last 6 to 9 months, we've actually spent a lot of effort trying to increase our access to sleep studies that also have outcome data. And in fact, right now we've actually secured access to approximately 15,000 polysomnograms. And we feel that this would be an adequate number of people that we could really use advanced machine learning as well as these signal processing algorithms to come up with very robust models as well. The second thing that we've done is using some of the funding that we got from the VGH Foundation, we've been able to hire a PhD student as well who's going to spearhead the project as a full-time student. The third thing that we were able to do is that we've actually already been able to identify some very robust characteristics that we think will be important in our machine learning models. So I think that we've done a lot of good progress over the last 1 year, and we think that we have a lot of momentum to bring the project forward.
We're here today to present an opioid quantification device that we've been developing on behalf of our team. The goal of the device is to be able to identify physiologic amounts of opioids that individuals are using in order to be able to pair it with effective and safe treatment mechanisms to help combat opioid use disorder and help save lives over time and revolutionize the way that we manage care for these individuals. So we're really excited with the progress that has been made in the last year. We actually have exceeded some of what we had anticipated to do over the course of this year. Firstly, one of the challenges of detecting fentanyl is because it's such a potent molecule. In order to be able to detect tiny amounts, that causes analytic challenges. So the first thing we've been able to do is actually detect fentanyl in such tiny, minute amounts that we're looking at part per billion sampling detection rates. So that's really exciting.
This funding has really enabled exponential progress within this project. We were able to take this device here, which started off as individual components in quite a fancy analytical laboratory, and really bring it down to sort of a desktop prototype. This is the first stage. It's fairly easily portable. We were able to team up with the UBC Capstone engineering team who were able to put together this very nice device here. And they really integrate the science that we've been working on the electrochemical side with the software interface to enable kind of a complete package overall of the device.
There's a couple of main next steps. The first is we're going to be transitioning from the validation that we've done so far and looking towards the validation of these samples in physiologic fluids, so things like saliva, serum, etc. in order to be able to then transition into the clinical phase of research. And that will include things like clinical trials and ongoing development for community and clinical use. Our hope is that this is the type of equipment that we would be seeing in hospital-based settings, in clinics, possibly at safe consumption sites, in all of the areas that we're interfacing with patients with substance use disorders and where we're providing treatment, to be able to really provide point-of-care understanding of what their usage looks like and to be able to pair that with effective treatment models.
Thank you for supporting innovation in healthcare.
Thank you for transforming healthcare in British Columbia.
Thank you for supporting VGH and UBC Hospital Foundation.